Introduce Mr. Mark Amott, who, is that right?
It is right.
It is.
About the first one.
Who has 15 years experience in health management consultancy and has successfully guided many practices to success. And also manages a 24-hour... Oh, you did? 24-hour emergency veterinary service. But I'd like to welcome him up to speak to us about setting up in private practice.
Thank you. I'm not going to use the microphone because I actually hate microphones, so I'm just going to stand out here. If you can't hear me, do say so, but we haven't had any issues so far. So thank you for the introduction. My name is Mark. I work for an organisation called My Practice Services. In simple terms, we do setups advisory in general business and rescues, which is what happens when you fall in the ditch when you don't get advisory or set up properly. So today, I'm here to give you a bit of a cook's tour about considerations of setting up in private practice and a little bit about hospital links and public work as well. So I hope that you've all passed your fellowships, or you may be just in the final stages of ticking off some boxes, so congratulations. I guess the reason you're here and what you'll be looking to is what next. And part of that will be consideration of private practice. So in the organisation that I work in, we deal with a lot of people who are looking to set out in private practice or who are already in private practice who are, I guess, reconciling the romance versus the reality of actually having another baby in the family being the business. So today I'm here to give you a few of the pearls of wisdom as to what you might well consider. Now, I guess in life, we all get an education, we then get married, buy a house, have some kids. It's quite formulaic. I guess in the medical field, we go to university, we specialise, we get out into, private practice land, and eventually we want to become an owner. It's a dream, and it's a wonderful dream, and if you do it properly, it can be very well rewarding. But there are some big buts. It's not the only path. And just because it's a formula, it doesn't mean that you have to follow it. We deal with a lot of people who are in private practice who feel trapped. They have an obligation that they can't necessarily get out of, and they would do anything to go back to being an associate or maybe even working in, just as a salaried employee somewhere. I was just in Queensland this week with one such practice. So it happens. So as you start out from now, from fellowship to what comes next, keep the end in mind. And just remember, there's more than one model. You can basically stay as a contractor, as a salaried employee or something similar if you wish to stay in the public system. You can be an associate, basically pay somewhere between 30 or 40% of your gross fees to someone who does own the practice. You get to walk in, walk out, and at the end of the day, the issues aren't yours and you still get a very, very good remuneration. Or if you do want to live the dream, you can become a practice owner. You too can do that and suffer all of the stress and work weekends and worry at night. You can do it. It's there. The rewards are great, but the obligations are also quite significant. So right now, think carefully about what you want before you commit. There's more than one model. Now, has anyone read or heard of The E-Myth by Michael Gerber? One in the room. There's usually one or two. Look, this is a really, really simple book. It's an easy read. It actually came out in the 1980s. And what it does, it tells the story of why most small businesses fail. And it basically follows the story of a lady who starts a pie shop. She loves her job, she gets into it, she's really good at making pies, and then somewhere down the track she wakes up one morning, she has headaches everywhere, staff complaining, customers complaining she's not making any money and she hates it and she feels trapped. This book basically follows a story about why most small businesses don't do it right, and the lessons are just as relevant today as they were in 1986 when this book came out. So suggest you read it. It's a really easy read. And the book talks, amongst other things, about three major roles in any business. And I'm going to call them businesses because they are businesses. The first is the role of the technician, and that's what you're really good at. You've trained, you're very specialised, you spend an awful lot of time and heartache getting to this point. But there are actually two other roles that need to be done, and they can't be done at 10 o'clock at night after you've done the technician work. And that's the manager, the person who deals with all of the other headaches and all of the other mechanisms around the work to make sure things run smoothly. And sitting there through the previous two sessions, you saw a snippet of some of the things that you have to consider. And it is a snippet. There are many, many more. And then there's the role of what Michael Gerber calls the entrepreneur. I like to stay away from that word because it tends to sort of, private equity and going to the Dow Jones. We're not doing that. But we are owners, and you're the only ones who can lead your business. No one else can do that. Those three roles all have to be done for a business to be successful. Now, you've got a little handout somewhere which you can refer to afterwards. But basically, when people come to us and say, we're looking at starting a practice, we take them through a little diagram and structure that we use called the MyPS 1 to 10. There is nothing new about this. All it does is it just categorises the things that you need to do to run a business successfully. And they're fortunately here in 10 spinning plates. Planning, you need a plan. You need a strategic plan, some basic financials. You need to communicate that to your team. There's going to be more than one of you, and there's going to be advisors outside. You've met two of them in the last two sessions. Accountancy / legal, and you're going to have a professional indemnity partner as well. Financial management, you need money to set up and then run this business. HR, there are going to be people and headaches in your business around those people. IT is becoming increasingly more important. You need to promote your practice to GP referrers and to clients and patients. Patient care and services, the work, that needs to be done. Environment and infrastructure, you need to have your practice somewhere. Quality, risk and governance, the Avant session touched on just a snippet of the things that you need to consider as a business owner. And there are going to be things in the other portfolio that don't fit anywhere. And of those 10 portfolios, the one that you've been trained in is the one up on the screen, patient care and services. So there are 9 other areas that you need to take care of in the baby that is going to be your business. And believe you me, this takes time and attention, and it can result in major headaches if you don't get it right. So, we've started with the dream of specialising, getting out, maybe working for someone for a couple of years and then starting your own practice. In doing that, the best way that you can prepare yourself is to know your limitations and focus on what you do well, which is patient care and services. There are going to be some portfolios there that are really, really important that you have to have some competencies in. You're going to have a basic command of finance. There are some regulatory issues that you need to be across. Quality and risk, HR is a huge minefield. Starting out with the best of intentions and hope is not a strategy. Things will go wrong. You need to know that you are prepared for those. So you may need to develop some skills. That's going to take some time and competence. You can do a master's degree in any of those other portfolios and still only scratch the surface of some areas. So you may decide at an early stage that you want to focus on what you do well, and you might want to outsource the things that you don't do well. The one thing I'd say about that, though, is that you can't outsource leadership. You are the only ones who can actually be the leaders in your practice, clinically, and also steering the ship from a business point of view. So if you do want to be a practice owner, you need to actually have that portfolio as yours, and you can't abrogate that. We walk into a number of practices where the clinicians are stressed, tired, trapped, and the story comes out that they really don't know how the practice runs. The practice manager does that. They just do the work, and that's usually a running away mechanism. Then you dig a bit deeper and find out why the practice isn't making money and there's all these complaints. You cannot delegate that. You need to be a good leader. So this is not an advertorial or a promotion at all. But if you do want to get into business, good advice is worth its weight in gold. You've just heard from two presenters before us who you essentially need on your side before you start, and you need to know the pitfalls. If you spend some money planning and getting the right advice, you will be so much better off, so much incomparably. And the earlier you get people involved, the better. So you may consider engaging somebody to help you through the setup and establishment phase, and then help you with business advisory and other portfolio advice along the way. We do that. There are many other groups that do that. What I would say, and this is my professional view, is you have enough to do in the consult room, in the procedure room. Don't do this bit. There are people out there who do it better than you do and will help you through at a fraction of the cost that it will cost you. So good advice, good things waiting gold. You're already ahead of the game because you're actually here today. Well done. So thinking about the non-clinical stuff, and I'm going to use a clinical comparison. When you see a patient, you're going to establish a treatment plan. You're going to go through that plan. You're going to monitor. There's going to be pathways. You may refer back to the GP. You may keep them in-house. You may refer off, or a combination of all those things over time. You've got a plan. You follow it. You keep notes. You track them. You keep your recalls and reminders up to date. They come back for those tests. There's rigor. There's discipline. The number of business owners that we meet, and we ask them why they're stressed and tired. They're doing the wages on a Friday night at 10 o'clock at night. They're getting it wrong. They don't want to do it. They don't enjoy doing it. They're not good at it. We ask them whether they want to let that go. No, I couldn't possibly have someone do that. That's my job. I don't trust anybody to do that. You look at how they schedule their time. They've got 10 sessions a week doing clinical work, and they're doing the other stuff, the managerial and the leadership work outside of that. Big mistake. If you want to be a practice owner, you need to put time aside during your week, at least a session a week, to do the important stuff that isn't clinical. So discipline is key. In that time, you need to turn your phone off. You need to get your plan out in those other 9 portfolios, and you need to actually, plan to review. It's really not that complicated or difficult, but it takes discipline. And what we find with practices that run into trouble and individuals that are stressed, tired, and trapped is that they don't do that, and then they feel holes in their businesses. Often they haven't thought about when they're going to do this work, and it just becomes reactive. So I cannot stress enough, if you want to be a business owner, you need to put time aside in your week. You need to have some goals, you need to have a plan, you need to review that regularly, and you need to get help if you're not coping. Just a bit about hospital links. Typically, a new fellow has spent quite a bit of time in the public system training. That's where a lot of your effort and relationships and expertise are. You're familiar there. You're going to be moving out into private practice, and most of you will likely keep some public appointments. Public versus private, these are two different tensions, and what we'd recommend is that you do keep a foot in public, but you are very, very clear about what you get from your public work and what you get from your private work, and that you don't let one affect the other. So let's just talk a little bit about how they might actually work together and synergize. So in private, to be honest, after you've been out for a while, it's going to be about getting, your lists and your sessions filled, seeing patients that you want to see, and actually making money from that. And so you should. You've been training for a hell of a long time. Why wouldn't you get a return on that investment? okay? But you may not see the big cases or the interesting stuff or get to work with, you know, fantastic people. If you're a solo practitioner, you could be very, very isolated. In your public work, it's not about the money compared to private practice, but it is about the relationships, it's about interesting cases, it's about prestige, it's about keeping your skills up in areas that you may not see in private practice, okay? So you're getting different things. The other thing is if you want to grow in private practice, after a certain point, that's going to mean that you actually consider other people. A great place to find these people, and I'm very sorry I did not introduce you at the front, Di Stewart, a colleague of mine. Di and I work with practitioners who say, I'd like to sell my practice or grow my practice. Where can I find someone to join me who might actually buy my practice? They're doing this at the ages of, 55. Okay, way too late. If you want to grow in private practice, the best place to find people is in your other fields of work and relationships who may want to come along for the ride. It's really, really important, and this is a great place in the public arena to find people who are like-minded who may want to do some work with you. So keep those relationships and networks warm. So look, today has really been a bit of a cook's tour. If there's one thing that you get out of this session, it's probably that IPS 1 to 10. Again, there's nothing new about it. It's there to give you a way to order some of the things that you may not be skilled in, but you do need to deal with if you are actually going to go into private practice. You're going to go away, you've had a lot of information today, even the sessions that I've been in. In your handout pack, there is a little sheet, and I'm just going to take you through it. It's worthwhile doing 5 minutes of this planning after the session just to keep this, fresh. If you do want to end up in private practice, do yourself a 3 or a 5 year plan. Do you want to stay in public as basically a salaried employee? Do you want to go out as an associate maybe in a couple of years? And in 5 years, do you want to be owning your own practice? If so, start your plan now. Okay, because there are things that you're going to need to do that require you to, get different skill sets, invest money. You're not going to just say, look, at Christmas, and we're helping a surgeon, who isn't obviously clear in this room, do this right now. This guy's been an associate with a group, and his associateship is coming to an end at Christmas, and he's saying, help, I might set up my own practice next year, and it's notionally December 1. That is not where you want to be. Okay? So, some goals and some roles at the top. Contractor/employee, associate, owner, and some basic goals, activity-wise or revenue-wise, about where you want to be. It's the thing that was said about notes. Good notes, bad notes, and no notes. Good plan, bad plan, no plan. No plan is no plan. Then go across the portfolios and rate yourself as far as your competency in each of them. Then underneath, think about what you're going to do in your practice. So, patient care and services is going to be, slam dunk. We've got high competency there. You're going to do it. With the others, if you do want to do them and you don't have the skills, then you're going to need to invest some time in doing some courses or getting some help. Okay? With a lot of them, I would say just outsource them. Do not bookkeep. If you are making, $600 to $1,000 an hour, you can get a bookkeeper for a tenth of that who will do the job twice as well in half the time. Why would you do that? You may need to know the principles of bookkeeping and how to read financial reports. Much more important. Then there's a little thing to keep you honest at the bottom, some sessions per week. If you want to be a technician, write that in. If you want to be an owner, you better be scheduling some time in your week to actually do ownership. If you want to be the manager and you want to do the bookkeeping, and I would absolutely encourage you to do some bookkeeping so you know how dry and mindless it is. Do a bank reconciliation. Then go back and do what you do well once you've done it once or twice. If you want to be a manager and you want to be actually doing the employment contracts and you want to be paying the people, then go and put some time for management, and all that will happen is that your clinical time and your revenue will drop. If you do it at 10 o'clock at night, your marriage and your health will come under strain. And I know Jeff was here earlier. He has some very good messages. No one here is Superman or Superwoman. Okay, we all have limits. If you want to run a business, do it sustainably, get some help. So there's just a little sheet for you to go away and consolidate some of the knowledge. So in closing, set your goals for the next 3 to 5 years and know your roles. Okay, do you want to be the owner, the manager, and the technician, or do you want to be realistically and be the technician and do the ownership and then delegate the management? Okay, be disciplined about the clinical activities, you've already got that. If you want to do the non-clinical activities, set time aside, get some structure, have a plan. Okay, think about how much public and private work you want to do. In the first couple of years of getting out, typically the strategy is to say yes to everything, then get really, really tired, then have a crisis, and then actually review what's sustainable. Just jump that crisis and plan it now. Obviously that hit a chord, so people have done that already. And most, look, setting up businesses and running them is not, it's not complex. It is difficult, but it's all been done before. So start with the end in mind. If in 5 years you want to be a business owner, start by chipping away now. Okay, it's not black magic. There are people out there who know how to do it well. You know how to do the technician's role well. Get some advisors together, spend some money, do some planning, and in 5 years, hopefully, we may cross paths somewhere and you are running a successful business, and hopefully today you've learned some lessons that will actually help you along that path. Thank you.
Thank you very much, Mark. I think there was some very valuable advice, not just for private practice, but for life as well in there.